It is the 4th of July Eve, and many holiday festivities are already underway. There's a good chance fireworks are in your 4th plans, or maybe the beach is more your speed. Here's a live look from Carolina Beach right now. No matter how you are spending the holiday, you want it to be fun and you want it to be safe. So whether it's fireworks or grilling out or swimming, Dr. Philip Lamptey, Cone Health Urgent Care Medical Director, is here to make sure that you do it and you do it safely. All right, let's first and foremost, let's start with the fireworks. Let's just kind of talk about, I know you've probably seen a lot in your practice when it comes to injuries that can happen, especially with the fireworks that are done at home.
Yes, the fireworks, I typically tell people that leave it to the professionals. If you decide to do it at home, you have to make sure that you're doing it in a very open area away from buildings. And also when you're doing it, protect yourself. Eyewear is important. Knowing how to work the fireworks is important. And then for your children, keep them away from the fireworks. If it's a community fireworks, make sure that you're at least a couple of hundred feet away, because loud sounds could cause permanent damage if you're too close to the fireworks. And then burns as well is one of the things that you have to be mindful if you are doing it at home. For the kids, give them flags to wave instead of sparks, because the sparks can get very hot, up to 2,000 Fahrenheit. So those are some of the things that I advise my patients who are coming to see us relative to some of these events.
All right, so eye protection, if you're going to be doing it at home, let the kids hold flags instead of the sparklers and that kind of thing. All right.
Yes.
So if someone, though, does get injured, when should they be seeking medical care and from where?
So with burns, I would say that if the skin is not broken, you could use a lot of the stuff we find in the stores, like aloe vera creams and other burn creams in the stores. If there is blisters, please don't break the blisters. Just put the aloe vera over that. And if the skin is broken, you could always reach out. You should always reach out to a healthcare professional. And you could do that for the Cone Web website. You can do that from the website. Do virtual visits, and you could also look for any of the urgent cares that is in town and make an appointment and come in to see us, or just walk into the urgent care.
Okay, that was going to be my follow-up question, is when do we know we need to go to the urgent care? I think so often we just think to ourselves, you know what, we'll just take care of it at home and we'll do what we can, but when is it that we need to go?
If your skin is broken from a burn, you need to get a health professional to look at it. If you have eye injury, those are things that need to be seen by a healthcare professional so that they will evaluate it to make sure that you don't need further treatment, and then make further recommendations from there.
Okay. All right. So that's the fireworks part. Let's go to the other part, which is 4th of July, which is the food. That is a big part of the holiday for sure. There's going to be lots of picnics and people are going to be out, and it's going to be 90-something degrees. Which means that we could easily get sick because something has been left out too long. So what is the rule of thumb there of how long we can leave some food out?
If you leave food in your car and the car heats up on a very hot day like we had yesterday and it's above 90 degrees, the food that comes out should be refrigerated within an hour if you have leftovers that you bring home. If you're grilling, make sure that the internal temperature of the food is as recommended, above 145 for meat products, and then above 165 for chicken products. So make sure it's well cooked. The leftovers are also another source of food poisoning. If you're grilling and you're done eating, make sure that you put it in the refrigerator within 2 hours after eating, and make sure the refrigerator is less than 40 degrees Fahrenheit.
And all right, he mentioned the degrees that it should be cooked at. He didn't say make sure there's no pink in the middle. So you actually have to use a meat thermometer to know whether or not you're grilling it to the right temperature or not. All right, so at what point would someone say, okay, I do have food poisoning, what should I do?
So if you are having vomiting that's not stopping, you have diarrhea with fever of 102 Fahrenheit or more, if you have bloody diarrhea, or if you start getting dizzy because you've had a lot of diarrhea and your blood pressure is not holding, or you're getting very dehydrated, those are the times that you need to come to be seen by a health professional. And again, you can go through the Cone website, conehealth.com/appointments, or look for the virtual options or the urgent cares to be directed as to what to do.
You know, I wonder with that, especially like if you have a family member who's sick and is constantly throwing up, is that something that could be treated virtual care, or do they actually need to go to the ER or urgent care?
If they are throwing up constantly and they cannot keep fluids down, then that is one that they have to have a face-to-face visit with a provider.
Okay, that is good to know. All right, we're going to take a quick break. We're going to continue on making sure that you're safe on this July 4th holiday with Cone Health. We'll be back in just a minute.